So we get a lot of questions all the time on what goes in my kit, what goes in a trauma kit. And that's a good question. That's a great question, actually. And we talk about that in class. So if you come to one of our classes, you'll get that answer and more. But what I like to narrow it down to is in order of importance. Okay, so we always talk about our, stop the bleeding, start to breathe, and treat for shock type of thing, or our trauma man thing where it's tourniquet the limbs, pack the junction, seal the box. I like to call it my top 5. So we're going to call this video Pocket Doc's top 5 items that should be in a trauma kit at a minimum. Okay, when I say trauma kit, we're talking major bleeding, life-threatening bleeding, severe traumatic bleeding. Okay, so some of our smaller kits, like our Mini Plus, things like that, they have the smaller roll of hemostatic, and we'll get into that in just a second. But the top 5 things. All right, first off, you need protection from cooties, okay? Gloves should be the first thing you put on and the last thing you take off. So a pair of nice thick nitrile gloves, multiple pairs, that's another important thing. Carry more than one pair, because if I'm putting a pair of gloves on, I like to slide that other pair on right over it. That way, if that pair gets soiled, torn, anything like that, I can go ahead and take it off, and I've got a fresh pair of gloves underneath there. Because if you try to get another glove on after you take them off a nasty sweaty hand, it's not happening. So at least a couple of pair of gloves. Okay, so there's some gloves. Now, tourniquets. Okay, so this is the North American Rescue CAT Gen 7. And this is the Tactical Medical Solutions Soft T. This is like their Gen 5, the latest one that's out there. Either of these, TCCC recommended tourniquets, and you'd be solid with that. So if you can carry more than one tourniquet, cool, do it. Because some people may need more than one tourniquet to stop that bleed if the limbs are bigger, bigger diameter extremities, things like that. So tourniquets are my next one. So gloves, tourniquets, okay, and the reason I say gloves first is because universal precautions. We got to protect ourselves from those bloodborne pathogens. All right, next thing, okay, we're talking about stopping that bleed. Some sort of hemostatic gauze. This is the Quick Clot Combat Gauze Mill from Z-Medica. And this is a battle-proven, combat-proven, austere environment-proven, worst-case scenarios, this gauze works. It stops bleeds very quickly, major life-threatening bleeds, and it packs into those areas where you can't get a tourniquet. Okay, so it's not amenable to tourniquet use. Think about this. That's 12 feet of gauze, y'all. That's 12 feet of gauze. That's a lot of gauze in a small package. And a lot of companies will sell a 4-foot roll of gauze, which is the minimum recommended for a moderate bleed, not a severe bleed. Okay, so severe life-threatening injuries, that's the one you want to have. So just because a trauma kit manufacturer may say, hey, this has got a roll of hemostatic gauze, how long is it? Is it 4 feet? Is it 2 feet? Because there's a lot of other kits out there that have 2-foot lengths of gauze. Or is it a full 12-foot roll? Because you may need even more than that. So gloves, tourniquets, hemostatic gauze. And if I've got a hemostatic gauze, a loose hemostatic gauze in a wound, next thing I got to have, number 4, pressure bandage. Okay, this is the emergency bandage. There's a lot of other bandages out there. Like in my ankle kit here, I've got a H&H mini compression bandage. Some of our visors headrest kits carry the North American Rescue Mini Responder 4-inch ETD, which is a cut down version. Clear Medical actually has a great 4-inch mini compression bandage. So a compression bandage, number 1, if I'm using a hemostatic gauze, I've got to have some sort of reinforcement to hold that compression in there, because we count on 2 things with hemostatic gauze: that's compression and coagulation. And so I've got to have that pressure bandage to focus pressure over that wound, over that gauze that's been packed in there, to maintain that good stable clot. Okay. Also, if I don't have to use my hemostatic gauze, I can use this pressure bandage here as an adjunct for my hands. And so I can hold pressure on that wound if it's a non-life-threatening bleed. So pressure bandage is always a good thing to have. So we got gloves, we got tourniquets, we got hemostatic gauze, and we got pressure bandages. Last thing, chest seals. Okay, this is the Halo Vent chest seals in my ankle kit. Just because of size constraints, I carry the Hyphen compact vented chest seals. All of them are great chest seals. They all work. They all do the same thing. So that's that final step when we talk about the tourniquet limbs, pack the junction, seal the box. So for penetrating chest injuries, I'm going to have a set of chest seals in there too. Now, some things you could throw in there just to keep it simple, you could throw a Mylar blanket in there, and that's just for hypothermia control if somebody's lost a lot of blood or if it's an environmental injury. But top 5, gloves, tourniquets, hemostatic gauze, pressure bandages, and chest seals. So big thing with this is not only carrying this stuff, but knowing how to use it and when to use it and why you're using it. Because just having it is not enough. You've got to get the training. So that's why we emphasize our training classes so much. We've got online training videos, but the big thing, that'll get you a good jumping off point. Nothing is a replacement for coming to one of our classes. So not only to sell one of our kits, like our EDC kit, our ankle kit, they have the bare minimum 5 items we talk about. Our bigger kits, like our dark and our hard case, they have a lot more stuff in there. But at a bare minimum, you need these top 5, but you got to learn how to use it. So come to one of our classes. Check us out on our website at darkangelmedical.com. Click on that training tab and see where we are in a place near you. If we're not, invite us. We'll come teach in your area as long as we got the required number of folks. But again, get a kit, get trained, and most importantly, be the difference. Y'all stay safe.